Hello, welcome to this presentation on COVID-19. I'm Doreen Geoghegan, Health and Safety Officer in GMIT. COVID-19 poses a public health risk. It's a worldwide pandemic. We haven't had a pandemic in 100 years. War needs to be declared on such infections, and the Irish government has reacted to this by requiring people to undertake hand hygiene, restriction of movement, social distancing. If a person is symptomatic, they must self-isolate, undertake a test and contact tracing. Vulnerable persons must cocoon. The number of cases currently stands at over 600,000. Over 130,000 have recovered from this infection. In Hubei, Wuhan, where the infection began, 67,000 were confirmed, and currently there are 62,000 who have recovered, with 2,000 active. When looking at the current cases, the province just south of where the infection arose has 1,018 confirmed cases, with 1,014 having recovered. This is due to the strict regulation of self-isolation and quarantine. There's good news in Europe also. A town in northern Italy called Geoghegan was home to where the first death occurred on February 21st. They reached 0 cases last week. They undertook testing of 3,300 residents. About 3% of the residents were infected with the virus, and of half of these did not show any symptoms. After 2 weeks of strict lockdown and quarantine of cases, only 0.25% of residents were infected. The town isolated these last few cases and has since reopened. To understand what we can do to prevent the spread of infection, we will look at the chain of infection. A single COVID-19 virus is 5,000 times smaller than a grain of sugar. Looking at the top left of the illustration, the COVID-19 is the infectious agent. The germ will incubate in a reservoir, which is in a person's mouth, throat and lungs. It multiplies here and exits this portal of exit through a cough or spittle. The means of transmission will be it either lands on a surface or is picked up by hands, who then transport it to the next portal of entry, which is another person, and enters through their mouth, eyes and nose onto the next host, where it multiplies and spreads again. Here we have a very clear breakdown of how we can break this chain in each of the steps along the way. If you want to pause the video here to take a closer look at this, please do. We know how quickly COVID-19 is spreading throughout the world. Here's the dangers of it and how it spreads. The virus can survive up to 72 hours on surfaces. A single cough can produce 3,000 droplets. The particles or droplets can land up to 2 meters on other people, clothing, surfaces around them, and some of the smaller particles can remain in the air for a period of time. There's some evidence that the virus is also shed for longer in fecal matter, in fact for over a month. This will be in people who have already contracted the disease. Anyone not washing their hands thoroughly after visiting the toilet could contaminate anything they touch. When we look at how the germ spreads, think of it as being like glitter. It adheres to your skin. Getting it off your skin takes effort, with lots of suds. Use the HSE guidance to wash your hands. If you soap up all parts of the hand and leave the soap for 30 seconds before rinsing off is very effective. Pay particular attention to the areas around your fingertips. Don't be a super spreader by not washing your hands or by touching surfaces unnecessarily or being in close contact. As we know, these germs travel by our hands. The hands carry them to other parts of the body, to equipment, walls, doors, furniture, and directly to other people if we hug or handshake them. Remember, it'll die if it doesn't get to a host, that is, a mouth, nose or eye. So play your part to make this happen. In short, to infect you, COVID-19 has to get from an infected person's nose or mouth into your eyes, nose or mouth, most frequently by ourselves touching our mouth. It cannot enter through the skin, so there's no need to wear gloves. It cannot be breathed in except if an infected person coughs within 2 meters. Behaviour to protect our vulnerable. Stay calm. We will get through this together. Wash your hands properly and frequently, especially before eating, smoking, applying makeup, or after using the toilet. Do not touch your face. Keep your fingers far from face. Assume your hands are unclean unless you've just washed them. Avoid touching high contact surfaces in public. Use a clean fork to eat rather than fingers. Cough or sneeze into your elbow or tissue and dispose of it. Stay at home. Leave home for essential trips only to the pharmacy, shop, medical or essential work. Wash your hands immediately when you get home. Social distancing within the home and outside the home of 2 meters or more. Self-isolate if you're infected and contact your GP and follow his instructions. The average person touches their face 23 times an hour. Some tips to stop touching your face unnecessarily are: use a tissue instead. Use it to rub your face or adjust your glasses, and then dispose of the tissue afterwards. Identify triggers. Why do you rub your face or rub your eyes? Do you have dry eyes? If you need to put moisturising liquid into them with clean hands. Or if you wear contact lenses, why not wear glasses instead? Keep your hands busy by using a stress ball, but remember to clean it afterwards. Take off rings so your fingers feel strange. Or remember, relax, because stress causes you to touch your face more often. Why do I wear gloves? Is this so I don't have to wash my hands? Or is it because I do not want to contract the virus when out shopping? A glove is another layer of skin, and COVID-19 cannot get through your skin. COVID-19 sticks to the glove if you come in contact with it. The glove will not kill the virus, just help you transfer it. Research has shown that wearing of gloves is actually more dangerous than not wearing gloves. So ask yourself, where do you wear the glove? What do you touch with the glove? Do you touch your face? When do I take the glove off? Do I wash my hands after I take off the glove? Do I take it off correctly? It's a mistake because at the end of the day we still have to wash our hands. In the area of food hygiene, people wear gloves to prevent the handler contaminating our food. This is the opposite. We don't want to get this germ into our mouths. So tell me, why are we wearing gloves in supermarkets? When do we wear a face mask? A face mask is for a person who has a cough to reduce the risk of a sick person transmitting it to others by droplet. Face masks hold little protection for healthy persons and can in fact be more dangerous and more likely for the person to contract COVID-19 as the mask is adjusted with unclean hands, or the mask becomes moist, trapping any airborne COVID-19. Allow the sick person to wear the mask. Naturally, we're all concerned we don't want to contract this disease. So ask ourselves, how could this germ come into our household? Are we taking any non-essential trips from our home? How can we protect from it? Where is the contact risk in our home or work, or if you care for a person at risk? Here is a list of items that kill COVID-19. Soap, such as liquid or bar. Detergent, washing up liquid or washing powder. Disinfectants, bleach, alcohol greater than 60%, hydrogen peroxide, Milton, Dettol. Bleach and other disinfectants damage equipment and may harm health. Using disinfectants kills naturally formed germs, good germs. So we're encouraged to use soap rather than the stronger disinfectants. The COVID-19 disintegrates with contact time. Soap or detergent kills COVID-19 as it has a fatty boundary, and this disintegrates with the suds. Alcohol sanitizer greater than 60% must remain wet for over 30 seconds to disintegrate the protein. Both products type must cover all parts of the hands and must be in contact for greater than 20 seconds. Disinfectant alcohol wipes kill COVID-19, but people misuse wipes and reduce the effectiveness. While disinfectant wipes clear off most germs from surfaces, it stays on the wipes, and if it's reused, the germ is transferred to a new location. To prevent this, use one wipe and then bin it. Most people don't give the wipe enough time to work its magic. Let the wipe area dry to air or leave 3 minutes, then wipe it clean. We will now look at COVID-19 disease and how it arises. Approximately 6 to 7 days post-exposure to the germ, where it enters your mouth, nose or eyes, the infection symptoms will arise. These involve a high temperature, greater than 38 degrees Celsius, a cough, breathlessness. On day 6 post the symptom onset, 80% will have recovered, 20% will develop breathing difficulty, and of these 20%, approximately 4% are critical. What to do if you suspect you have COVID-19? Take your temperature with a thermometer 2 times a day and monitor for fever, that is over 38 degrees Celsius, and accompanied by cough or shortness of breath. If you have 2 or more symptoms, call your doctor so they can arrange a test. Stay home and avoid contact with others in the household. Self-isolate for the required length of time. Take paracetamol as prescribed. Social distance in car travelling for the test, ideally 2 meters apart. Keep a diary of persons in contact with for greater than 15 minutes since symptoms began. Report any absence to your supervisor or line manager. This is a stressful time for everyone. There are some supports available through the HSE, especially for a coronavirus outbreak, or the GMIT Employee Assistance Programme. The number for it is 1800 817 435, and it is available for members of our family over 18 years of age, free of charge. If people are working from home, it's important we take breaks as you would do at work. Be disciplined and avoid overwork, which is hard to do. Keep in contact with your coffee pals through video chat over a virtual break using Microsoft Teams, WhatsApp video or Zoom. Stay safe and enjoy our spring. Enjoy the fresh air and the safe oxygen we breathe in the west of Ireland. Stay positive as this time will pass, and let's work together to make it pass faster. Thank you.